Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response efforts. Joining me again is interpreter Margie Prop, and thank you so much, Margie, for being with us today to provide your services. And thank you to the media and the residents who are tuning in to find out how you can protect yourselves, your loved ones, and our community during this challenging time. We want to remind everyone to visit our website, covid19.lincoln.ne.gov, where you can continue to access additional updates and resources to help navigate through this pandemic. The website includes a data dashboard that is updated each day around the time of this briefing, where you can learn more information about local cases and our health department's investigations of them. The website also features our COVID-19 Risk Dial, a simple tool designed to help all of us know what actions and behaviors we can take to protect our health and that of our neighbors. The COVID Risk Dial provides a visual, color-coded depiction of local conditions we're experiencing, a forecast of risk, essentially. Red represents the highest risk of COVID-19 spread in our community, and green represents the lowest. For each color of risk, we provide specific recommendations for physical distancing, face covering, hand washing, illness monitoring, and disinfection for when we are at home, at work, or out in the public. The health department team has determined that the risk of spreading COVID-19 in our community continues to be high, so the COVID dial is orange. The orange level community guidance includes the following recommendations. Stay home as much as possible, and definitely stay home if you are sick. Stay at least 6 feet distance from others. Face coverings are strongly recommended for anyone over the age of 2 when you are outside of your household. And continue to wash your hands frequently and disinfect highly touched surfaces. We begin our briefing today once again with deep regret over the death of one of our Lancaster County residents to COVID-19. We have now lost 6 people in our community to this disease, and on behalf of our city, I offer condolences to all of those who have lost a loved one. Here in Lincoln today, we have had an additional 90 individuals test positive for COVID-19. And while this would appear to be the highest one-day total for the number of cases reported in Lancaster County, we do need to acknowledge that there has been a large backlog of test results from a private lab at the end of last week. Many of those test results from last week were received only today. The total number of lab-confirmed cases in Lincoln now stands at 898. Our total recoveries identified to date remains at 120 individuals. Interim Health Director Pat Lopez is here to provide further details of the Lincoln-Lancaster County Health Department's investigations of these cases, and I invite her to the podium now.
Thank you, Mayor. We continue to work closely with Public Health Solutions, the Public Health Department in Saline County, on the outbreak at the Smithfield plant there in Crete. We have no new cases related to the Smithfield Crete plant to report today. We have previously identified 261 Lancaster County residents who are positive cases related to the plant. 160 are employees at the plant, and 101 are family members or other direct contacts. Our local plants are also reporting no new cases today. Smithfield and Lincoln remains at 17 positive cases, and Smart Chicken and Waverly remains at 12. We continue to work with these facilities to provide more testing. The positivity rate is down to 8.4%, down from a high of 9.8 last week. The state rate and national rates have both dropped to 15.7. From Friday through Sunday, Bryan Health and CHI St. Elizabeth completed about 650 tests at their hospitals and through the drive-through testing sites. We have received about 950 test results back for Lancaster County residents through Test Nebraska. Again, we do have the ability to do more testing. If you have symptoms of COVID-19, you can get tested now. To get started, you can fill out a risk assessment at chihealth.com or bryanhealth.com or testnebraska.com. Today, our local hospitals report 42 COVID-19 patients in their care. That includes 21 from Lancaster County and 21 from other parts of the state. 12 patients are on ventilators, 5 from Lancaster County and 7 from other parts of the state.
Thank you so much, Director Lopez. The mission of our local public health department is to protect the public's health every day, and they do so in myriad ways. The department's responsibilities include the mitigation of environmental hazards, injury prevention, the promotion of healthy behaviors, disaster response, and equitable access to quality public health services. At the same time, the department plans and trains for health crises like the pandemic we are now experiencing. The health department was ready from the beginning to take the lead on our community's response to COVID-19. Under Director Lopez's leadership, our health department has done a commendable job in working to slow the spread of this virus. Our local public health team has the expertise and experience in proven methods to combat the spread of the disease. One of the most important tools that we've all heard a lot about during this pandemic is contact tracing. This is not a new tool. Contact tracing has been used to respond to other public health emergencies, including the smallpox outbreak in the 1950s, as an example. Contact tracers have long been employed to prevent the spread of diseases like these. And with the novel coronavirus pandemic, contact tracing and its importance have come into public view like never before. While we discuss it nearly every day at these briefings, today we want to take a deeper dive into this method of disease prevention. Contact tracing sounds simple. Alert anyone who has been in contact with an infected person and prevent them from spreading the disease to others. Yet contact tracing involves a tailored plan for each disease and a dedicated workforce with investigative know-how and great people skills. Director Lopez is going to share with us some of the details on exactly how contact tracing works here in Lancaster County.
As the mayor said, while contact tracing is a common public health practice, it is a highly specialized skill. To be done effectively, it requires people with training, supervision, and access to social and medical support for patients and contacts. It also requires a thorough understanding of patient confidentiality and an understanding of the medical terms and principles of exposure and infection. With our department's 16 public health nurses and the recent addition of 11 public school nurses, we have a total of 27 staff available to conduct case investigations. Within 24 hours of the health department being notified of a new COVID-19 diagnosis, one of these nurses contacts the patient by phone to check on their welfare and take a full history, where they have been and who they have interacted with while symptomatic, and in those 2 days prior to having symptoms. Because COVID-19 is spread primarily through droplets, we define close contacts as all those in the patient's household, as well as anyone who spends more than 10 minutes less than 6 feet from the infected person. Those close contacts are advised to quarantine for 14 days and to avoid interaction with others. They are also asked about their living situation, whether they have a separate bathroom to use, whether they can take days off work, whether they have enough groceries. The nurses also are able to refer them to services that will help with cleaning supplies, food, and workplace notification. In working with those who are not proficient in English, the contact tracers work with translators from the health department, or they work with our cultural centers and services like Language Link. In addition to answering their questions and addressing their needs, the contact tracers must build their trust and maintain confidentiality. Early on this pandemic, our local investigations were able to obtain people's travel history and establish connections between where they were exposed and places to which they had traveled. In these cases, travelers were advised to quarantine for 14 days. As we started to see more community spread occur, following up with additional close contacts of infected individuals became a more prevalent part of our case investigations. Take, for example, a person who works in a large business with multiple positive cases and who also lives with family members at home. The contact tracer will add all these family members to their contact list and will identify where those family members work and where they may have been. As any one of the family members or other direct contacts could work at a hospital, nursing home, or large manufacturing plant. If they are symptomatic also, identifying where they work may help us find additional cases in the workplace, which we would call a cluster. Cluster identification is critical in order to stop other outbreaks with the pandemic. Getting individuals out of that workplace and quarantined or isolated as quickly as possible will slow the spread of the disease in our community. When clusters are identified, it also allows us to know where to focus additional investigation, testing, and education. This also greatly reduces the likelihood of the spread in large workplaces. One person can start a chain reaction that branches out through multiple contacts in a number of workplaces or other households in a short period of time. The graphic on the screen illustrates with a small blue dot in the center representing a positive COVID-19 person. This person infects another person who then infects two others in another household. Then these people have direct contact with people in a different household, and the web continues to grow with the new cases, as you can see. To minimize spread like this, contact tracing will go hand in hand with widespread testing, trace, test, trace, and repeat until the cases diminish or until we have a widespread vaccine.
Thank you, Director Lopez. We want to provide an update from our Lincoln Fire and Rescue team. They want everyone to be reminded that it is safe to call 911 for medical emergencies during the COVID-19 pandemic and that hospital emergency rooms remain open and safe. We've seen a reduction in calls to 911 during this incident. We really don't want concerns about exposure to COVID-19 to prevent anyone from calling 911. Our fire and rescue personnel are using procedures designed to protect patients and first responders from exposure to the coronavirus. If you or someone you know has a need for emergency services, please do not hesitate to reach out. And with all those on the front lines in mind, we want to acknowledge that this is EMS week, and our city joins communities everywhere in saluting the dedication, hard work, and bravery of emergency medical services professionals. The theme for this year, Ready Today, Preparing for Tomorrow, is especially fitting as our EMS workers are on the front lines of this COVID-19 crisis. Now more than ever, it's important that we honor and celebrate our EMS professionals who are putting themselves in harm's way in order to support the health and well-being of our local community and communities across our nation. In other good news, our planning department reports that they are ahead of last year's pace for applications, and there does not appear to be a slowdown in building permits. And last but not least, today marks another Sunshine Monday, when we are again sharing some of the beautiful art created by Lincoln Children as part of our Sunshine Kids for Seniors project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork and encouragement. And if your family would like to participate, you may send your scanned notes and art to sunshinekids@lincoln.ne.gov. Please just first names only on the artwork. And with that, we will open it up to questions from the media.
This is Riley Johnson with the Journal-Star.
Hi, Riley.
Hi, Riley.
I had a question for Director Lopez.
All right, she'll be right here.
Good afternoon, Riley.
Hi, Pat. Could you tell us more about the individual who is the most recent death in the community? Were they hospitalized? Did they have any underlying conditions? Were they a known patient?
Yes, they were a known individual that was COVID positive, and they had been hospitalized for over a week now.
Did they have an underlying condition?
Yes, they did.
And where, I mean, it's still small numbers, but comparatively, but do you have a sense for the death rate that this county is experiencing with coronavirus compared to the state?
You know, Riley, I don't have that right off the top of my head, but when you look at the state numbers are at 126 deaths, and we're at 6 today. So our rate, I know, is smaller than other communities.
At this point, though, you have no cause for concern about us being anomalous to other counties.
And I think we've seen our death rate has really increased more in the last week and a half than it has throughout the process, but we've had more positive cases in the same time frame.
Thank you.
I have another question for Pat. This one comes from Brent at Channel 8. Wants to know if there have been any citations issued in Lincoln for people violating COVID-19 health restrictions.
Yes, I have issued an isolation order. But I won't be able to discuss further because it's about an individual.
Just want to clarify that earlier when I reported our total, as you can see on the dashboard, confirmed cases is at 889. Just want to clarify that number. Any other questions?
Riley with the Journal Star. Could you speak about the number of people that were tested on Friday at the Lincoln High School special testing site?
Yes, I believe it was 111 individuals. That's correct. 111 individuals who were tested at Lincoln High on Friday.
Are there further plans to sort of work on testing in association with the cultural centers?
Yes, I mean, we absolutely want to continue to test as many people as possible in our community and to do so in meaningful ways where we know people are at greater risk or who may have barriers to accessing testing, whether they be economic or communication barriers. And of course, when we look at our data and see the disproportionate impacts on folks in different ethnic minorities, we want to make sure that we are doing consistent outreach and partnership and collaboration and working with the leadership of our cultural centers to ensure that those numbers come down and we see those disproportionate impacts diminish over time. And I think Director Lopez is forward to say a little bit more about that.
I just wanted to add a little bit to that the testing went very smoothly, and we had very positive reports back about the testing. So as the mayor said, we'll be looking at other opportunities, and we're meeting again with the cultural centers tomorrow evening to go over that. And Riley, I also wanted to tell you, in between time, the state death rate is 6.6%, or 6.6 per 100,000 population, and ours in the city and the county is 1.9 per 100,000 population.
Pat, this is Bill with 1011. I got a quick one for you.
Sure, Bill.
Yeah, is there any plan to identify the people who have died from COVID-19 related issues as far as age or sex in the near future, or do we need to get to a bigger number before that happens?
We'd like to get to a slightly bigger number, and we are tracking the age and sex. And then we'll be reporting on it, Bill.
Thank you.
And we hope we don't reach a larger number. Of course, that's our goal, to prevent death.
Any further questions? All right, well, thank you so much for tuning in. We'll be back again tomorrow at 3:30 with the latest updates. And thank you for all you're doing in our community to protect yourself, your loved ones, and your neighbors. See you tomorrow.